Doctors of Reddit, what's the biggest case of faking it you've ever seen? Taking trauma call during surgery residency. Had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal. But we would shield his legs so he couldn't see them and poke them with needles and other sharp objects. With enough force to cause pain, he never flinched or moved his legs at all. He was diagnosed with SORA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week. No improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road. Naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink and that there was no spot on her skin anymore. She stormed out threatening to sue. I'm just glad I cured her melanoma. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests. Didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine. Tests are negative. You can go home. Patient gets up, gets dressed and walks out without a word. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying. Full stride. Going places. We were all fools. Whenever we had kids, usually teenagers, playing up their symptoms to extend their hospital stay, we would order them into a healthy lifestyle. Lights out at 9. No screen time for 2 hours before bedtime. Healthy diet chock full of fruits and vegetables. Screen time limits. Minimum number of laps around the unit per day to get in their exercise. They got better so much faster with our healthy lifestyle tips. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second. Weigh up the repercussions. Then either pee themselves or stop faking. I thought that was hilarious. Sorta along the same idea. Working at a pharmacy, we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated "Ossa hello" wave. She started to throw her arm up but caught herself halfway through. Then threw her hand back into her lap and pretended to be Ossa off into nothing. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking. Tried to keep eyes rolled back into his head. A whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh. And of course his eyes were back to normal and focused. One time my roommate, who is an IQ nurse, came to see one of my indoor soccer games. During the game a player on the other team went down hurt and starting screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game brooding in silence before he left early. After the game my roommate told me he was going to go over and see if there was anything he could do to help. Until he saw that the guy was limping on the wrong leg. Was told this one by a fellow nurse I used to work with when we had a psych floor. It's not unusual for psych patients to stash things in various orifices. This one woman was convinced she was impregnated by a ghost-like figure but no one would believe her. So one day she started complaining of massive pelvic and uterine pain. She called them contractions. So the doctor goes to do an exam. The doctor feels something larger in there so they prep a table to get the object out which was quite large. So the wonderful third year helping with the procedure starts hearing this woman complain of contractions and yelling things like should I push? I'm gonna start pushing. Full stop. Doctor trying to work forceps around this woman's parts as to not hurt her. Finally goes got. And as he starts saying it he pulls out a baby doll. Head only. The poor med student did the wobble. Went all flush. Had problems keeping balance and about took a dive. I was told he didn't live that down the whole rotation. I once saw a patient who had been faking paralysis of the legs for years. Used a wheelchair. Never walked. Etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family friends were just going along with it. Not sure if it was really conversion disorder or if the patient had some secondary gain issue. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tonopin, a device you poke them directly into the eye with, and they go what the is that thing? Obligatory not a doctor. I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the DR had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his in staff room laughing. Next week the patient loses his in reception because his insurance has been cancelled. Guy came to ER. I was a nurse at the time. For stomachache when asking him about history he randomly mentions a fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. ER nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. When I was a medical student I worked in the pediatric side of the emergency room and we would give popsicles to all the kids. One afternoon an 8-year-old came in with his father. And I asked what was wrong. The kid couldn't remember what he complained about to his dad. and the dad couldn't remember why he brought his kid in. The kid's mom was a nurse. She was working at another hospital at the time, and she was the one that would keep track of these things. Anyway, after a few minutes trying to figure out what was going on, the kid asked, "So, can I have my popsicle now?" The kid was 100% healthy. Unfortunately, we reinforced bad behavior and both the kid and the dad subsequently left with popsicles. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. Years ago, I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual "I'm crippled" paraphernalia: crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex, power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her "I'm crippled" get up on again. Few weeks later I got the subpoena for the deposition, and it all became clear. I'm a surgery resident. When I was on my trauma rotation, we had a patient come in after an MVC with question that maybe the patient had seized and that had caused the accident. So he's in the trauma bay and starts shaking. The trauma nurse goes, "Oh, this isn't a real seizure." And the patient stops shaking, sits up, turns to the nurse, and yells, "You don't know a thing about me. Full stop." Not a doctor, but I was in the ER one night and there was a seeking drug addict who literally only acted in pain when there was staff around. You ever see those videos where the little kid is fine and then they spot a parent and then bawl, then immediately stop and be fine when the parent is out of view? Exactly like that. Sat fine. No movements or wincing or noises, then wailing when a nurse was in the same vicinity. Then back to fine when they left. A few weeks ago, I had a vulvar biopsy. I was petrified of this procedure, and I didn't know how to ask the doctor if I'll be given pain meds because of people like this. There is no way to even frame the question without sounding like a drug seeker. I ended up not needing anything at all. But still, figure it's a legit question. But you can't ask it. 4th year medical student. On my ER rotation, and a trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor. Didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. Though some of the nurses said that they caught her peeking at us when we'd leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Not a doctor but nurse. I once read a specialist consultation report, and at the end of the report the actual diagnosis given was fictitious ailment. I had a patient when I worked in a ICU that was sedated and on a vent. A family member showed up out of nowhere and was staying day and night. I got pretty suspicious of them because they were clearly lying about knowing this person. Just talked to the fake family member about how it must have been sad since they just celebrated their birthday a week or so before getting ill. This person said it was a wonderful party and such. To which I replied their birthday hadn't occurred yet and wasn't for months. Turned out when security came it was a homeless person who snuck in and found a room with a sedated patient and decided to make it a place to stay. Needless to say, security to enter the ICU was absolute. Prisoner came in with signs and symptoms of a big stroke. At that time the protocol was to get a non-contrast head CT to rule out a bleed and then give TPA. A powerful clot-busting drug that's only worth the risk if the benefit is to mitigate a major stroke. So that's what happened. Later in the course he got a little carried away and started embellishing his story with symptoms that didn't make sense with his stroke diagnosis. And that's how we figured out he was faking it just to get some time away from jail. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Edit. Yes. Sternum rub. Got it. Not me. But no, an army doctor who prescribed everyone with cold-like symptoms or sore legs to stay in bed for the whole day. Then next day half as many people with symptoms showed up. My EMT instructor told me he and his crew ran on a seizure call. Gets there. Doors wide open. Female patient is unconscious and buck-ass naked. They start assessing her while one guy clears the house to make sure no one else is inside and gets something to cover her. After doing an arm drop test and trying to check her pupils, they all figure out that she's faking her illness. However, their general policy was never to openly state that, but to just roll with it instead. In line with that, he starts to call for an ambulance to come take her to the hospital. When one of his guys says, "Captain, she's clearly faking it," then this woman, who is supposed to be unconscious and unresponsive, says, "No, I'm not." When I was a kid I learned I could fake sick and get out of school. So 1-2 days a week I would get a migraine and hold my head and complain and I would get to go home. Eventually my parents took me to a neurologist who said, "Maybe you just don't let him eat chocolate and sugar." I grew up the opposite way. I would get 3-4 migraines a week. But everyone thought I was faking it because most days I seemed fine. Just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was wasted. Edit. I've replied to a lot of you nice people, but I'm on mobile and it will only load like 200 replies and I can't view any more to reply on. But I like reading your responses. Much love to you all. ER patient registers with chief complaint of dental pain. Allergies to every known NSAID. Yes. I know this can actually be genuine, such as with AID. Close bracket. This is a small rural hospital. So I happened to see this guy go across the hall to the lounge and help himself to a big mug of hot black hospital quality coffee and proceed to drink it in the waiting area. On asking about the dental pain, he reports that the pain is severe and worsened by drinking cold or hot liquids. His head and neck exam is non-acute, and he is discharged to home with instructions for supportive care including ice packs and follow-up with his dentist ASAP. His dissatisfaction is loud and salty. I saw father and his son wink when I was turning to face them again when I was done writing a note to stay home from school. That's pretty much it. Faking it is a hard call to make in general. I used to work as an EG tech and we had a patient come in at the end of the day from A&E. to get the results quicker. We also had the consultant neurologist with us to formally assess the study. This woman was faking it. And was really bad at it. too. Still, we had to go through the motions. And she wasn't faking it. She was definitely having epileptic activity. Fooled a veteran neurologist. A 25-year veteran EG tech. And a couple of us other techs with only a few years under our belts. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom, just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night. Dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells, and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. When I was a kid, I used to fake sick for no other reason than I wanted to stay home and hang out with my grandpa. He knew exactly what I was doing and would 90% of the time make me go off to school. We lived with him. Every so often though, he'd wink at me and we'd convince my mom I was feverish and then spend the day together watching movies and being best buddies. I was like 9 or 10. I cherish those days because he passed away when I was 19, now 31. I would give anything for one more of those days. My mom's an ER nurse and she said once some crazy lady came in and complained that she had the whooping cough. And whenever she coughed she followed it with a loud whoop. She's doing it wrong. That's a coughing whoop. Obligatory, not a doctor. I was an EMT and had a frequent flyer who rotated through various chief complaints. One which was complete blindness, emphasis on complete. We did our duty. Of course. Got him on board. Took vitals. BLS'd him to the nearest hospital. But we occasionally had a bit of fun with him. One of the blindness calls. We noted that he walked a rather narrow and windy path from his trailer to the rig without any issue. Once on board the rig, when asked for his insurance card, he fingered through his wallet and fetched it from among a mass of cards without issue. When asked direct questions, he met our gaze and followed it when our heads moved. When I pointed all this out to him, his only response was to quickly look at something over my shoulder and stammer through, "No. I'm blind." Okay. Our mistake then. Off we go. No doctor, but a funny story from work a couple years ago. Guy calls in sick for around 8 days. Says on the phone he is really sick. Comes back to work the next week. Tandas FCK. This dude hands a medical slip to the manager written in Spanish. On the slip there is an official seal from some random Cuban clinic. Semicolon. Guy walks over to me with a grin on his face saying, "Yeah, I'm probably fired." He was fired. 30-year-old woman came to the ED with such excruciating belly pain. Paralyzed. "Oh god, it hurts when you press there. Must have oxycodone now." ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks. Then got kicked out of the ED. A few years ago I hated my boss. So I would have lots of migraines, headaches too severe to head into work. After seeing the same doctor a few times he referred me to get a MRI brain scan. I played along. 3 hours later I was rushed to ED at my local hospital due to having 2 lower brain aneurysms. I never had those headaches. I was faking them. Bit of a blessing in disguise, I suppose. Former scrub nurse. Patient was on the table having a minimally invasive procedure. Carrying on and asking for more and more, versed in fentanyl. She was already maxed. She had a tolerance despite claiming to have never had narcotics before, or suddenly begins yelling, "I see the light. I see the light. Does anyone else in here see that light?" 6'4" mountain of a man circulating nurse gets in her face and says, "No. And neither do you. Now be quiet and let us do our job." Patient calm. Normal vitals and resting comfortably. Not a doctor but a nurse once had a patient having a seizure. The other ER nurse and I knew she was faking it. He said as much. She suddenly stopped seizing, miraculously. Looked straight at him and yelled, "Shut up, fat boy." He and I laughed so hard. He, the other nurse, was referred to as such, fat boy, for few months after that. At least she wasn't having a seizure. Close bracket. Edit.